Can you introduce yourself and your organisation?
Yeah, my name's Adam Winter and I work at the Lesbian Gay Foundation. We provide direct services and resources to more than 40,000 lesbian, gay and bisexual people each year, which is more than any other charity of our kind in the UK. We campaign for a fair and equal society where all lesbian, gay and bisexual people can achieve their full potential. And our mission is ending homophobia and empowering people. A big part of my role personally is around engaging local and national public sector and government partners around the importance of lesbian, gay, bisexual and trans people's issues and needs.
So why does the good use of information in health and social care matter to lesbian, gay, bisexual and trans people?
In 2009, the LGF released its strategy, Breaking the Cycle, which was in order to help deliver a sustainable LGBT sector. And in that we identified that the lack of evidence around LGBT people's issues and needs really fed into a lack of engagement and knowledge of policy and decision makers around those needs, which again fed into a lack of LGBT specific work in the voluntary community sector, and also a lack of LGBT work in mainstream services, which then, and that lack of work then fed back into that lack of evidence. So there's a real kind of vicious cycle there, which we think the use of good quality evidence in health and social care will really help to break that cycle.
What are the main issues or challenges that lesbian, gay, bisexual and trans people face in health and in social care?
Well, there are a broad range of issues that we think disproportionately affect lesbian, gay, bisexual and trans people. Mental health needs remain really important for all of those groups. In the recent GP patient survey, lesbian, gay and bisexual people were more than 3 times as likely to report a long-term mental health problem. And we also think that suicide and self-harm is a real big issue for all the communities within lesbian, gay, bisexual and trans. Sexual health remains a really big issue for gay and bisexual men. Particularly, HIV is still here, although it's fantastic that combination therapy now has had a massive impact on HIV positive men's lifespan. It is still a terminal disease, and it is still something that is still spreading and growing, particularly in the big population centres of London, Brighton and Manchester. Drugs remain. The Lesbian Gay Foundation has done is in the 4th year of a 5-year study on the drug and alcohol use of lesbian, gay and bisexual people, and we saw in that study that lesbian, gay and bisexual people were roughly 3 times as likely to have used an illicit drug in the last month compared to heterosexual people, and we're also binge drinking at very high levels as well. Particularly gay and bisexual men and lesbians are much more likely to smoke than the wider population. And there are also, it's important, we use the term lesbian, gay, bisexual and trans as a bit of a kind of catch-all, but each of those 4 groups within that have some very specific needs. Trans people have real issues around fairness and equality of access, around gender reassignment services. There's a bit of a postcode lottery, it kind of depends on how good your GP is on that. Bisexual people, bisexual men and women are largely invisible to both kind of LGB, kind of gay-specific services, and also to mainstream services. Lesbian and bisexual women, again, there is a real lack of visibility there. The LGF is really pleased that it is leading on the very first national campaign around lesbian and bisexual women's health, which is around informing lesbian and bisexual women of the importance of cervical screening. Access to good quality services and services that people rate highly is a real issue for all LGBT people. Again, in the last GP patient survey, LGBT people were more than twice as likely to rate their GP as poor or very poor on a range of different measures, such as the GP gives you enough time. And there's also a lot of other issues for individual groups within LGBT people, such as older people, isolation amongst older people. Older LGBT people are much more likely to live alone in the wider population. Obviously for young people, homophobic, biphobic and transphobic bullying is absolutely rife in our schools, so that's another real issue. And there's also issues for black and minority ethnic LGBT people, disabled LGBT people, so there are a lot of issues out there that we're trying to raise awareness of.
What could make the biggest difference to health and social care for lesbian, gay, bisexual and trans people?
Well, we really think that all publicly funded health and social care services really need to discover, as a matter of urgency and as a priority, need to discover and meet the needs of their LGBT&T service users. Now, they can do that in a number of ways. One of the ways we're really pushing for in terms of LGB service users is sexual orientation monitoring, better monitoring of sexual orientation of staff and service users within public services, particularly within health and social care, because that will give us the real quality data and quality local data to establish what the needs of LGBT people are, and also where those LGBT people are in the country. And also, really good use of that data is going to be really, really important. For the trans community, monitoring is slightly different because the numbers of the trans community are considerably smaller, but there are still ways to engage and involve your trans service users through active community engagement, which is something that we'd also recommend for LGB and indeed all service users. Training is a real issue, training for healthcare workers and other people such as GP receptionists, and really support for organisations, public sector organisations, to really support staff with any perceived challenges that they might face. All policies should be fully inclusive of LGBT&T people, and there needs to be greater awareness of the huge range of services, voluntary community sector services, that GPs and other healthcare professionals can refer their LGBT&T patients and service users into. And it's also really important just to do simple things around visibility, like having LGBT&T affirmative images in publications, and also taking part in programmes such as our Flying the Flag programme, which is where we ask public sector organisations to fly the gay rainbow flag on 17th of May, which is the International Day Against Homophobia and Transphobia.